we are broadcasting live from Bisozi Health Centre IV. Aliyamu kumanya Bisozi Health Centre IV. It is almost 1 kilometer, one on town. See? Almost 4 kilometers. Yeah. Almost 4 kilometers. Health Centre IV. Yeah. Almost 4 kilometers on town ya Bisozi. Aliyamu kumanya ebitweka ebya Bisozi igombo ranjiji ya Nkoma sub-county. So far, so good. Ayirwaro ebya Bisozi Health Centre IV. Okay? Bisozi Health Centre IV ni waro ebya malakire kalingwa gine kizubu ekibebazi. But currently the good news is iwaro ebya Bisozi Health Centre IV currently weekend tumu basekono tungawa masi ebebazi eri almost 16.2 million ekyo tumayisa okuhereza ino kubyo mugangwa ali abantu abokutunga okuhereza obwayirwaro ebya Bisozi. This is almost the best health center omuisaza ebya Kiwali East namukwaza hamwe na disiyona ya Kamwenge. Here in charge we were ebya Bisozi Health Centre IV omukuru Dr. Ojok Denis. Is a tough name. Maybe for those who knows those names, is one of the in charge of Bisozi Health Centre IV. Online, yes, we have some talks about how did you come to study this medicine. Names first.
Thank you very much, dear listeners. My name is Dr. Denis Ojok, the in charge of Bisozi Health Centre IV. We are now a Centre 4, not a Centre 3. A Centre 4 has a doctor as an in charge, and as you can see, Bisozi Health Centre 4 has a doctor and other staff around. Talking about drugs, it has been a long run because we should have received this much earlier. But I'm happy to tell the community members and all the listeners that currently in Bisozi Health Centre IV, we have the medicines that we need to use to treat the people that come and seek our services. About getting this medicine, I would like to very much thank Honorable Minister who has been with us along the way. When we were lacking, we informed him and he made a serious follow-up until when we received the drug. And when I talk of Honorable Minister, I mean Honorable Minister Frank Tumwebaze, who is very supportive of this facility. Whenever we have any challenges, maybe financial, maybe materialistic, we contact him and he looks around to ensure we get supported. So I would like to thank him very much. In the same vein, I would like to thank the district chairperson, Honorable Karunji. We informed him when we were not having the medicines. I think he also added his voice and support. I would like to thank the district town, the district health officer. I would like to thank Nkoma sub-county chairperson, Honorable Kabuye Abe. I would also like to thank Rukunyo Hospital because they have been supporting us with the supplies.
In fact, that's what I wanted to ask you. Before receiving this medicine, how have you been surviving all those situations?
We have been borrowing from nearby facilities within the district. One of the facilities which have been very supportive is Rukunyo Hospital, headed by Dr. Ivan Mujuni. I want to thank him very much. We also mobilized from other facilities like Kabambiro Health Centre IV, Bikodi, Ruamwanja. I want to thank MTI very much. They have really been very helpful to our new facility. Most of the time when we reach to Ruamwanja, that is heavily supported by Medical Teams International. We have two in charges in Ruamwanja. We have medical clinical officer, Alex. Then we have the in charge under Medical Teams International, that is Dr. Raphael Hon. Each time we would reach those two, they would also go to their stores and see how best they could help us. We are really very, very grateful. I want to thank Bisozi Health Centre IV staff, members. Anytime you come here, you find them around. Even this early morning when you reach, you have seen they are already on the ground working. They are very, very supportive staff, very competent and knowledgeable. I want to thank the community at large, the community we serve, South County, Kiwale East, and the district at large. During the time when we were lacking, they were very supportive. And now that we have, I would like to invite them to try. These medicines are not for sale. We don't expect anyone to buy these medicines because they are for government of Uganda. They are labeled.
You said you received almost the medicines of value that seem to include million.
Yes.
How are they categorized, those medicines?
Thank you very much. These medicines are categorized into two major groupings. One of them we call the essential medicines. These are drugs we use daily, like some injections for treating cough, for treating flu, treating diarrhea. We also have tablets. Then we have emergency medicines. These are medicines we give to mothers who are bleeding, we give to people who have collapsed, we give to those ones who need immediate attention, maybe accident cases. We also have IV fluids. We give to people maybe whose blood pressure low, we want to step it up. We have other fluids we give to people who have low sugar level in the blood, those ones who have not eaten for a while. So these are drugs really we give to someone in order to enable them to recover faster or regain consciousness we have. Then we also have others which may not fall under essential. So all in all, these drugs are well spaced, they are well classified in the sense that any patient who comes, we can handle, like drugs for diabetes, drugs for high blood pressure, now we do have.
Thank you. For those who have joined us currently, we are broadcasting live from Bisozi Health Centre IV. Together with Bisozi Health Centre IV. I'm together with Dr. Ojok Denis, in charge of the doctor of the facility. We have been seeing different patients being referred to health centers, those clinics, to get some tablets. Should we say that problem will be no longer be here?
That problem will no longer be here, referring them to buy medicines. Now that we have, there is no reason for us to refer them. And being a Center 4, we ideally don't refer to clinics. However, about referral, I would like to mention that as a new facility, there are some structures we are yet to get. One of them is a theater. So those ones who need operations, we refer majorly to Untitled Hospital because we are yet to get our theater. And I understand the process of starting the construction is in the pipeline. I'm hopeful that very soon we shall also have it started, so that when it is completed, we will not be referring such patients.
Thank you very much. Now, now the medicines are available.
Yes.
What do you assure the community?
I assure the community of the services, which I would like to mention as follows. In Bisozi Health Centre IV, we have outpatient department, which run every day, that is from Monday to Sunday, from 8 a.m. to 5 p.m. At night, our outpatient department is closed. Then we have inpatient department. Inpatient department is open 24 hours. So when OPD is closed, patients can just come and go straight to IPD, which is the second building after this OPD building. When you enter the gate, the first building is OPD, then the second one where patients are admitted is called inpatient department. That department works 24 hours, 7 days a week. So when you find OPD is closed, maybe if you come at night, please proceed to IPD. You will find us there waiting to serve you. We have maternity department and family planning. Mothers come here for antenatal care. They come to deliver. We serve them very well. And I want to thank that department very much, headed by Sister Apollo and midwife Eunice. We have never lost a baby in Bisozi ever since we started. So that means monitoring is really very good. I thank that team.
How do you handle those who wants to for theater? How do you handle them?
Those ones who we have maybe diagnosed, they have conditions which have theater, we categorize into two. We have emergency cases, like mothers who are afraid to deliver. That one we refer immediately.
Here you have a problem of ambulance. How do you handle them? You also hire ambulance from other health centers?
For ambulance, we have two priorities or methods that we use. One, the district has two ambulances, which is stationed at the hospitals. So we call and they come if they are not busy. We call Ruamwanja. That is why I want to thank Dr. Raphael very much and Mr. Alex. When we call them, they always come. Then if it happens that those two facilities have their ambulances engaged. Now that is where the problem comes in, and we have informed our leaders. I think they are in the process of ensuring we get our own ambulances.
In fact, you said to achieve this, there has been intervention of Minister Frank Tumwebaze.
Yes.
What are the other challenges in his response about other challenges you are facing here?
Other challenges, we still don't have a maternity unit, which I understand is about to be built. That one is in the pipeline.
He's aware.
He is aware. So they are about to start building it. They are going to mobilize out to secure the funds from Dr. Deep, so that one we can roll it out because they are going to work. Then theatre. I was informed that they are also going to construct at the same time as maternity unit.
Then
ambulance, the minister is following, and also our district leaders, like the district chairperson, they are following. So when they get it, I am very optimistic that they are going to bring. They are following. Of course, we may not get all in one day, but I'm sure the minister and other district leaders are following.
Very good. Omuliza wa Nyumbani FM olukize tuli ayirwaro erya Mwanja wa Bisozi Health Centre yakana namunga agwa emibazi ebyote kutunga kumsongole ekya National Medical Stores almost eriyo kasente kakwinga na 16.2 million norango ezonese nyingi tutumanyisa ngu aliyabo alimaika ayirwaro erya Bisozi Health Centre yakana bakutunga challenges namunga agwa emibazi etali mwenemwe. It means currently that will be no longer a problem. Still again, we need to get more from Dr. Ojok Denis. What are more other services that are here currently?
Thank you very much. I mentioned IPD, OPD, maternity, family planning services. We also have Adolescent Clinic. These are for young people who are now turning to be adults. We serve them very well. We conduct outreaches within all areas of Bukoma sub-counties. So you talk of Pidunduma, Kaberebere, we have been reaching all those places. So when you see our staff, please support them. They bring for you some medicines there in the community, they bring the vaccines. We also have HIV and TB treatment clinic here, which is a new development. Now for those ones who have been going very far to get medicines, Bisozi Health Centre IV is now here. You can just come and we give you the medicine. We have immunization services, which is done daily. And under immunization, we have all the vaccines that we give: hepatitis B, polio, COVID vaccine.
You also have COVID vaccines here?
Yes, and we have been vaccinating people. We have any day, anytime someone comes, even if you come at night and you go to IPD, we are going to vaccinate you. And talking of COVID vaccine, we also vaccinate during outreach activities. So if we have a group of people, let me say 10 and above, and they want us to vaccinate, sometimes we make arrangement and we go and vaccinate them from where they are. So that is how we also give back to the community. We have started a new clinic here for cervical cancer screening. We have actually noticed that maybe going up to far facilities may limit our community members from getting this service. We started, so for women of reproductive age who want to come and check if their cervix is healthy or not, please come. We are going to screen you. We have laboratory services. We now have a microscope. We have electricity. We have other tests that we do. So the lab services is well established. So we are very grateful. So when you come, we are going to test you before we treat you. So we don't do guesswork here. We crack, we examine, we test, then when we find the right diagnosis, that is when we treat by giving the right prescription.
Very good. Almost in Koko, in the last year, Namonga, I were living by a guy. Yes.
You should also ask the in-charge about most hospitals and health centers are affected by or disturbed by understaffing and drug or medicine stockouts. So how are they ready to fight drug stockouts? And you should actually give us a comment about understaffing with Bisozi Center for there.
We are a new facility. I think we started daily operation from the 1st of July 2021, which means we are yet to make like 4 months offering daily services. So the staff members that were started with from here were picked from other existing facilities. We have not yet done recruitment for Bisozi Health Centre IV. We are supposed to be 48 staff members, but we are 15. That one means that we are not enough.
Out of 48, currently you are 15.
Yes, however, I would want to tell the community members that the district is aware. Recently, the District Service Commission has advertised, so they are in the process of recruiting for Bisozi Health Centre IV. So the office of the cow and the District Service Commission is handling that. So they are recruiting, and we shall be enough. But even the 15 people who are around, we are giving services. Don't wait for recruitment to be done before you come. You just come, we shall give you equal quality service. Then about drug stockhouse. As a government facility, we receive medicines from National Medical Store. We make order every 2 months, but even before the 2 months, we do annual procurement plan. For Bisozi, we did it in May before it was open. So we have our annual procurement plan where we are supposed to receive yearly medicines of more than 98 million, which is a good amount. However, that 98 million is divided into 6 samples, so they bring every 2 months. Sometimes we get delays, other times they bring drugs. But I'm happy to say that National Medical Store has brought medicine, and we are also very grateful to them. Yes. About controlling medicines, one, we don't want any theft of drug in this facility. Every medicine we receive, we enter in the stock card, and it is tracked. When it is issued to the ward, the amount is also counted. When it is dispensed to a patient, it is also captured. So we have a good control system for our medicines, meaning that these medicines will only go to the right beneficiaries.
Okay.
Not be stolen.
Recently, the Ministry of Health was like over COVID-19 vaccination. For you in charges, doctors, you make sure those vaccines are used. How is it here?
In Bisozi, we do daily vaccination. Because, one, we want the people in the community to have access to these vaccines. Then we also vaccinate during outreaches. We also go to churches. Like yesterday, we were in this church near Bisozi Primary School. We were able to vaccinate close to 30 people. So here we do vaccination. We give the right vaccine at the right site to the right kind of clients who need them.
So you have not faced the challenge of vaccine getting expired?
The vaccine has never expired in Bisozi Health Centre IV, in Kibale East, and also in Kamwenge District. The district health team, headed by our DHO, Dr. William Uchunguzi, they ensure that we do everything possible to mobilize the community to benefit from these vaccines which are sent by government.
Very good, very good. We are almost finishing. What would be your last message to the community, the public, or those who are listening?
To the community, let me start by inviting pregnant mothers. Please come to Bisozi Health Centre IV. We offer services, as I've told you, delivery. You can come here in labor. We monitor you very well until you deliver. Even those whose time are not yet due, they can come for antenatal services. We provide it free of charge. We have a team of midwives who can handle that. They should come. Then these other patients who come to outpatient department, we come for admissions, we have the beds, we have our wards with electricity, we have water. We have never run out of water here. I also thank National Water for that. So let them come for the services which we have in this new facility.
Very good.
Yes.
And we have initially have this family planning services there, and some is actually put in Kasese. According to the information from Kasese, and those health facilities are faced with the challenge of these young girls trying to get family planning services. Have
family planning services are available here, and we offer them free of charge. We have criteria for selecting which method is fit for which other client. For example, even use of condom is a mean of family planning, which we can give to those ones that we see they are fit. Then specifically about young girls coming, when they come, I told you we had Adolescent Clinic. We talk to them and get to understand their problem in them. Yes. Okay. And we advise them accordingly. If we find they also need family planning services, and according to the laws of Uganda, we find such a client is eligible to receive, we also give. Because if you look around, most of our mothers are actually young, especially those ones who are pregnant for the first time. Some of them are below 18 years, which according to the laws of Uganda, they are regarded as children. But as medical workers, our work is not to judge, our work is to treat and provide services. So we provide to all of them when they come, and we keep it confidential because that is the right of the patients. And we don't judge them, we don't disclose their information. So if we have girls or adolescents or young people in the community who would want to come and get services here, I highly welcome them. We are going to treat them professionally and ensure they are handled based on ethics and integrity. Thank you.
Very good. That's the current situation at the Bisozi Health Centre IV. The good news is, in one of the Bisozi Health Centre IV currently, Tumwebaze almost centers 16.2 billion. Ekyo kimanyisa ngu omuntu obenaiza irwali ya Bisozi okashaka bamutwaliye kugira ngu azatungi amulendizo mbazi that one will be no longer a problem here. Ekyo kimanyisa ngu ali abakaza okugenda kuzaala nikyo Tumwebaze nshasha omutwe n'omugongo ebintu bikubire nk'ebyo bibyo services they are available here at the Bisozi Health Centre IV. Back to you Omusheshe Komole n'omukizo kisenyumbane FM Studio B Nandi Godwin mwine mulangira amwani gwa Bisozi Health Centre IV.
This is normal saline, a type of IV fluid. This is dextrose 5%. This is ringas, lactate. Then the one on this corner is half strength, Darrows. All of them belong to the categories of IV fluid. We also have other supplies here. We have other supplies like this one. We use them for family planning. We distribute free of charge to people. We have face masks. You know, COVID is a pandemic and a serious one. So we also protect ourselves and we protect the lives of those ones who come serve. We have another store. These ones are lab supplies for collecting stool, for collecting sputum. So when we put sample in, then we take to the lab for testing. We take to the laboratory for testing.
You received it when?
We received on the 14th.
14th last week?
Yes, on the 14th of October 2021. Then we have another. As you can see here, we have different medicine types. Here basically we have tablets which patients swallow. We have for children, we have for adults, we have for pregnant women. Then on this side we have the injection. Those ones which we inject into the back, or we inject it in the blood vessels. So we have them here. We also have medicines for HIV clients. And we have medicines for TB clients. We have gloves. All this you are seeing there, gloves.
Is that gloves?
Yeah, so we believe these ones are enough for our patients. We don't expect them to buy gloves. This is the type of glove we call disposable gloves. Then we have another type of gloves called surgical gloves or sterile gloves. So these ones, when we are going to do very clean procedure, is when we put on. We also don't expect patients to buy.
How do these differ from this one?
In terms of difference, this one is better at preventing infection because it is sterile. It has no organism at all. So when we are going to conduct delivery, we put on this surgical glove. It is the same type of glove that is used in the theater. But this other disposable type, when I'm going to inject you, I put on it. It also prevents me from infecting you with organisms which I may have in my hand, but it is not as clean as the other one. The other type is for very clean procedure, what we call sterile procedure. On this side, we have medicine for malaria. Yes, which we believe are enough for our patients. Then we have injection. This is a testament, also medicine for malaria. Then on the other corner, when you see, that is the corner for laboratory. We have small bottles which have red top, purple top.
Is that the first testing COVID?
These ones are for taking blood. So we take blood, we put it here, then we take to the lab for testing. Then here we have cannulas. People who are given IV food, they put a cannula. So we have enough, we don't expect patients to die. We have medicines for asthma, we have medicines for stopping pain. Maybe when someone gets an accident and we are supposed to repair a wound, we use this medicine so that the person does not feel pain.
So there is even a lab here.
We have a laboratory. Then we have medicines for stopping bleeding in a pregnant woman after delivery or after an abortion. We have here the testing strips for hepatitis. We do test for hepatitis. We treat it from air and we also vaccinate. This is water for mixing medicine. Those medicines which we inject, we mix with this water so that it is safe when it is injected into a patient. As you can see, our store is really organized and it is easy to know which one is missing and which one is not missing. So the issue of theft is actually not here, because when I enter here, I can easily see this specimen. Is there a box missing? And if it is missing, we find press where it goes. There's big issue with the word, which is whether.
So whatever medicine is issued
Is recorded in the stock cards. Those ones are the stock cards for all these medicines. Then our laboratory. If you want to read our laboratory.
Very smart.
Very smart in uniform.
However,
I
names
think they
are
are written their face now.
but they don't have names here. We need to know the names.
You get your name tag. They have the name tag. Personnel who work here. Now they put it into samples.
Samples from here.
So this room, when we develop and acquire another fridge, is going to be a blood bank, a mini blood bank. So that when someone needs blood, we just run it from here. This is the store for the laboratory. The other one is the washroom. This is the washroom for washing hands. This one is the washroom. That's the same, connected to the clean water supply. So our lab, as you can see, is also equally organized like the store. When we started, we never had a microscope. Yes. As you can see, this one is new. We have now got a microscope and we use it to test malaria and a number of other diseases. These are the samples put in the glass slides, they view under the microscope so that before we treat, we are sure of the disease. So here, I told you earlier, we treat a client or a patient based on the professional guidelines.
We still have more stuff. Sister. When you tell me sister, you never about my sister, my son.
So the name is there, very smart in uniform and her face.